Hello, my friends, my family, and my fans. I am Andrew Ditch. I have been diagnosed with autism and intellectual disability. Today, I want to talk about a really important topic. This is very important for millions of other adults with autism. This topic shows how incompetent the medical and mental health field really is. You go to a doctor when something bothers you, like when physical pain, stomach problems, or even when your behaviors are not seen as the social norm. This is where I start with how incompetent doctors are in identifying autism and intellectual disability, and how they often can use masking as a way to misrepresent someone's behaviors as noncompliance or argumentative rather than part of their intellectual disability or developmental disability. What are the differences in autism versus schizoaffective disorder? Autism and schizoaffective disorder can look superficially similar in a few areas, especially if someone has communication differences, sensory overload, or shutdowns, but they are fundamentally different types of conditions. Your question is important because misdiagnosis between these two does happen, especially for autistic people with intellectual or language disabilities. Below is a clear, structured breakdown grounded in the search results you triggered. Brain core difference. Autism equals neurodevelopmental condition present from early childhood. Schizoaffective disorder equals psychiatric disorder involving psychosis plus mood episodes. They come from different parts of medicine, develop differently, and require different treatments. Magnifying glass-tilted left side-by-side comparison. Autism spectrum disorder, ASD, based on URP behavioral health and neurolaunch sources. Begins in early childhood, usually before age 3. Affects social communication, sensory processing, and behavior. Includes restricted interests, routines, and repetitive behaviors. May include language delays, intellectual disability, or motor/sensory differences. No hallucinations or delusions. Symptoms are stable across life, not episodic. Treatment focuses on support, communication, sensory regulation, and accommodations, not antipsychotics unless there is a separate condition. Schizoaffective disorder, URP behavioral health. A psychotic disorder combining schizophrenia-type symptoms, hallucinations, delusions, disorganized thinking, mood episodes, major depression, or mania, requires at least one psychotic episode without a mood episode to diagnose. Usually begins in late teens to adulthood, not early childhood. Symptoms are episodic, with periods of remission. Treatment involves antipsychotic medication, mood stabilizers, and therapy. Direct hit key differences that clinicians look for. 1. Psychosis versus no psychosis. Autism does not include hallucinations or delusions. Schizoaffective disorder requires psychosis. 2. Developmental history. Autism signs appear very early: communication delays, sensory issues, repetitive play. Schizoaffective disorder appears later, after normal early development. 3. Mood episodes. Autism does not cause manic or depressive episodes. Schizoaffective disorder includes major mood episodes. For course of symptoms, autism is lifelong and consistent. Schizoaffective disorder is episodic, with flare UPS and remissions. 5. Sensory processing. Autism, sensory overload, hypersensitivity, shutdowns, stimming. Schizoaffective. Sensory issues are usually related to hallucinations, not processing differences. Counterclockwise arrows button, why they get confused sometimes. Search results note that autism is sometimes misdiagnosed as schizoaffective disorder, especially in adults with limited speech or atypical behavior. Reasons include: flat affect can look like negative symptoms of schizophrenia. Social withdrawal can be mistaken for psychosis. Communication differences may be misinterpreted as disorganized thinking. Sensory overload reactions can look like agitation or paranoia. But the presence or absence of psychosis is the biggest dividing line. What is the difference between a thought disorder versus autism and intellectual disability? The search results you triggered focused on autism and intellectual disability, but did not provide information about thought disorder, so the comparison to thought disorder is based on general clinical knowledge. Brain what each term actually refers to. 1. Thought disorder. A thought disorder is a symptom, not a developmental disability. It refers to disorganized thinking, which affects how a person forms, connects, and expresses ideas. Common features include tangential or incoherent speech, loose associations, jumping between unrelated ideas, word salad difficulty, staying on topic, delusions, or psychotic thinking in some disorders. Thought disorder is most commonly seen in schizophrenia, schizoaffective disorder, severe mood disorders with psychosis. It does not appear in autism or intellectual disability unless there is a separate psychotic disorder. 2. Autism spectrum disorder, ASD. Based on search results about autism versus intellectual disability. Autism is a neurodevelopmental condition present from early childhood. It affects social communication, sensory processing, flexibility, and routines, behavior, and interests. Autistic communication differences may look unusual, but they are not disorganized thinking. They come from language processing differences, motor planning issues, sensory overload, executive functioning challenges. Autistic speech may be literal, scripted, delayed, echolalic, paused, or slowed, but it is not psychotic or disorganized. 3. Intellectual disability, ID. Based on search results from Autism Parenting Magazine and ABA Journey. Intellectual disability involves below average intellectual functioning, adaptive skill delays, daily living, safety, communication, onset before age 18. Key features include slower processing difficulty with abstract reasoning, challenges with problem-solving, need for support in daily tasks. Speech may be simple, concrete, limited in vocabulary, but the thinking is still organized, just slower or more concrete. Sources: Autism versus Intellectual Disability Explanations from Autism Parenting Magazine and ABA Journey. Side-by-side comparison. A thought disorder symptom of psychotic disorders. Autism, neurodevelopmental condition. Intellectual disability, neurodevelopmental condition. Thought disorder, usually late teens. Adulthood, autism, early childhood, intellectual disability, early childhood. Thought disorder, disorganized thinking, autism, social communication plus sensory differences, intellectual disability, global cognitive plus adaptive delays. Thought disorder, incoherent, tangential, illogical, autism, literal, scripted, delayed, or atypical, intellectual disability, simple, concrete, limited. Thought disorder, often present, autism, not part of autism, intellectual disability, not part of ID. Thought disorder, brain-based psychosis, autism, brain-based, developmental differences, intellectual disability, cognitive, plus adaptive impairment. Thought disorder, episodic, autism, lifelong, stable, intellectual disability, lifelong, stable. The most important distinction: thought disorder equals disorganized thinking. Autism equals different thinking. Intellectual disability equals slower or concrete thinking. They're not the same. Autistic people with intellectual disability may need prompting, have limited speech, struggle with abstract reasoning, use scripts or AAC, have shutdowns or overload. But their thinking is organized, consistent, and rooted in developmental differences, not psychosis. Puzzle piece: why they get confused clinically. Especially for autistic adults with intellectual disability, clinicians sometimes misinterpret echolalia, disorganized speech, sensory overload, agitation, literal thinking, paranoia, communication delays, thought blocking, AC use, incoherence. But the motivation and cause are completely different. If you're interested in disability topics, such as treatment, support, accommodations, and rights, like this video and subscribe for more inclusive content. I will talk to you on my next video.